most have joined. Welcome everybody to our monthly Science Meet Business meeting. Topic of today is startup and startup community in the region of Nijmegen. Of course, in Nijmegen we have a strong focus on the science around health and healthcare and high tech, of course. But Science Meet Business is mostly focused around healthcare. Major areas there, drug discovery and digital health. And of course, we like to stimulate as much as possible startups in our community to grow. But science, of course, alone is not sufficient to grow companies. The strapline of Radboud University Medical Center is always to have a significant impact on healthcare. But to create impact, we also need to address entrepreneurship. I always say impact is research times entrepreneurship. So if there is no entrepreneurship, there is not going to be any impact. And of course, if there is no science, there is not going to be an impact too. In order for this to be successful, we need a strong cooperation between science and business. And therefore, as SMB, that of course stands for Science Meets Business, we are happy to give the floor today to several speakers in the area of entrepreneurship and health in the Nijmegen area. Program for today, we have 5 speakers. First, I hope that's possible. I don't see him yet. Mark Janssen from the board of Radboud University Medical Center. He will give a short introduction on the vision of Radboud University Medical Center towards this combination of science and entrepreneurship. And of course, we'll stress the importance of this combination. After that, Nico Karsemeijer will give a presentation about Screenpoint. Nico is CEO of Screenpoint, one of the leading AI companies that was once founded in Radboud University Medical Center and is still located in Nijmegen. And of course, a good example of how a startup company can be successful. After that, Sven de Klein from IMEC iStart will talk about the accelerator program they run in Belgium and how they are bringing this program to the Nijmegen region. In my view, this is exactly the kind of program that we need in our region. A longer term program, 18 months, because healthcare is a complex business. And I really hope we can get the program up and running after the summer. After Sven, Corné van den Kiekeboom will talk about from Exile Diagnostics, and he also is a startup from Radboud University Medical Center, and he will share his experience up until now. And the final presentation will be from Joram Sjoerds, Director of the Knowledge Transfer Office, who will talk about how Radboud University Medical Center plays a role in helping startups, helping the entrepreneurship in general in Radboud University Medical Center, and how we can grow employment in the region that way. After this presentation, there is room to ask questions and some discussion. We have many participants, and therefore we like to receive the questions preferably by the chat, and then I can ask the questions to the presenters. Around 5 o'clock the program ends. There's the possibility for networking after the breakout rooms. I really do hope that this is the last time we have to do the Science Meet Business meetings online, because I definitely miss the bitter balls after 5 o'clock, but of course mainly the good conversation you have in real life. But also I've seen that this kind of random networking we do in Zoom also leads sometimes to unexpected encounters that you would not have had if it would be only offline. Some rules for the meeting. Please keep your microphone open during the presentations. Keep your microphone off, of course, during the presentations, and do the questions in the chat. And it is always nice for the presenters to keep your video connection open so they can see who they are presenting to. It gives a bit more feeling of interaction, and you're not talking to the digital world only out there. With this, I'd like to conclude my preliminary remarks. I don't see it yet. Is Mark?
I'm in.
Entered the room? Yes, there he is. Very good. Then I would like to give the word to Mark Janssen from the board of Radboud University Medical Center. Mark, the floor is yours.
Yes, thank you, Martijn. Welcome, everybody. Very nice to meet you, and of course, not live, but via Zoom. But well, we do our best, and I'm happy to introduce this Science Meets Business meeting. I have 2 slides, and can I have the next one, please? Yes, science and business. Well, I think they can't live without each other. And especially when your aim is to have a significant impact on healthcare. And that is Radboudumc, our University Medical Center mission, to have a significant impact on healthcare. And we want to lead in sustainability, innovation, and an affordable healthcare for the children of our children and their children. So we aim into the future, national and international. We want to be leading. We think in a way that that's the right entrepreneurial spirit. And in our search for high potentials, we seek that entrepreneurial spirit as well. At Radboudumc, everyone can and may work on innovations. We support it with time, with the proper responsibilities, sometimes with money, budgets, to start projects, experiment, and if the opportunity is seen, try to bring it to the market. And every day, we aim for better care, better research, and better education. And of course, valorization. And we want to understand how diseases originate, how to prevent, treat, or cure them. And first of all, with patients, but also with business partners, with entrepreneurs. If I can have the next slide, please. Healthcare is a human or a people's business. And without innovations, we can't solve or cure future problems. Like the COVID crisis, it shows. Because of the burning platform, many innovations accelerated due to the cooperation between science and business, healthcare, science and business. And we took some risks, but then everything accelerates. And now I have my first vaccination, maybe you too. So within a year, what normally takes 5 to 10 years, we succeed in a cooperation. And okay, maybe you read it or heard it on the news yesterday, the Dutch government spent about 9 billion euros, of which they didn't met compliance rules. Okay, but it was a crisis. And science, it starts with ideas or problems. And that's also what businessmen, businesswomen, entrepreneurs do. So in some sense, scientists are entrepreneurs. They seek solutions to problems or opportunities. They are creative, they are persistent, and it's in their DNA to explore new ways. And they are also used to competition. So that's very important and meets entrepreneurs. But of course, there are some differences. And that is why we think at Radboudumc, scientists and entrepreneurs need each other to accomplish the impact mission we have. And that is why science and business needs to find and meet each other. And that is why science meets business. And it's also a great opportunity to have a significant impact. So I wish you all a very inspiring meeting this afternoon and hope to see you soon live, of course. Thank you.
Thank you. Yeah, what we always do, it's always normally we would ask for an applause, but we always do it like this. The way that deaf people applaud, very good. Thank you. Thank you very much for your words. Maybe one question, Mark. Of course, the valorization department already exists a long time. And we have even some of the startups that coming out of the community here in this meeting. But would you say that towards the future, that you think that entrepreneurship will be even more important for Radboudumc to really stimulate that?
Yes, I think so. Yes, because well, look at our mission. If your aim is to have that impact, and the impact is, well, in society, and we can explore and do research in our labs, and that is, I think we're very good at it. But it really meets societal needs if you bring it to the market in cooperation with entrepreneurs, or bring it to society. That is what we think, what we believe in, that you have well, severe impact, have really impact.
Yeah, no, that's nice. Now we hear a bit more from Joram, I think, at the end of the meeting about the specifics of how we will do that.
If I may add to that very concretely, that is, we are granted a Horizon 2020 program with the EU, in which we collaborate with Radboudumc, with UMC in Barcelona, Copenhagen, and Milano, to help PhD students to discover their entrepreneurial interests as well. So that is actually a concrete plan already started at the UMC Radboud.
Okay, that's interesting.
Thank you, Paul.
Thank you. Okay, thank you, Mark. Then we go to Nico Karsemeijer, the CEO of Screenpoint Medical, one of the artificial intelligence companies that came out of Radboud University Medical Center. And I think that you can't call a startup anymore, but has grown quite a lot, I think. So Nico, can I give the floor to you?
Yes, of course. So my phone's unmuted. Yeah. So yeah, happy to be here to give you a short presentation about the company, and also how it got started out of Radboud UMC. So first a bit about the company, and then a little bit more about the startup phase and how we have been growing. So we focus on breast cancer, especially early detection, but also more general breast cancer diagnosis, and in the future also treatment. What we are started to focus on, how I founded the company, is that there's a big problem with breast screening. There are too few radiologists who are really good at it. It's difficult. Often, usually 2 radiologists read these screening mammograms. The workload's increasing because 3D technology is introduced. And most of all, it's known that radiologists, even when they read these mammograms together with 2 independent readers, they still miss around 25% of the cancers that in retrospect they should have found. That has been recognized already very early on. And in radiology, I think also in medical imaging, that this was the first artificial intelligence application that became really popular, really big already in the 90s. We started working on that. And I was part of the team that developed the first product. It was a company based in California that I consulted with, and actually also the company that paid for my position in Radboud during those years, where I was working as a postdoc. That was a very interesting time, because there I learned what it is to build a company, go through all the phases. And what we did was make a machine that digitized films, automatically detected spots that could be breast cancer, and fed that back to the radiologist. Very complicated, because these films had to be read on a viewer and so on. Nowadays, and that product became tremendously successful. In the US, after the reimbursement took place, FDA approval since around 2000, it was quickly built up, and about 90% of the clinics, the reading of mammograms was done with either this technology, which was by far the dominant product, and a product of a competitor. So very successful, has been running for 20 years. But in the university, I've been developing, where I stayed in Radboud, much more advanced techniques. And I was disappointed that this didn't get into these products of the US company, which moved into a bigger company. And at some point I decided it would be great to make another startup and do things better. This is a little bit how these systems work today with digital mammograms. They point at abnormalities. This is a 3D mammogram. This consists of a number of slices. It's a lot of work for these radiologists to go through thousands of cases and find the few early breast cancers that are detectable there. So this is an example in one of these slices. There's a breast cancer here. It's just one of the 60 slices in every view that I'm showing here. Here's the abnormality. It's not so easy to see, but it's picked up very accurately by the system. So this can be, and this will be a tremendous help, especially if you realize that with AI technology these days, where we are now, and this is again for 2D mammography. These are publications. We were the first to publish very widely together with Radboud on the results that we made, that we did with the product developed in the company. So what you see here is the increase in performance of the AI algorithm, and the light blue line, which is the lowest, which is means the lowest quality. These are the radiologists. This is where we were already in 2018, and especially for a regular 2D mammography, which is used everywhere in Europe. We are superior, clearly superior than almost any radiologist today. So we're now coming into the phase, how do we deploy this? How do we get this into the market? So let me then take you a little bit through the history of why I founded Screenpoint and how. I've been working all my life with startups, founded also a couple of companies, and these are the people I worked with a lot, and especially Mike Brady from the University of Oxford. We also established another very successful company. It's based in New Zealand. And these are the early days that I worked with this Californian company to build that first AI product for mammography. So I started to develop the idea of creating a new startup to introduce a better technology with a few students that they had at that time around 2012, 2013. It took about a year actually to get things started. It was difficult, I think, also for some people to realize that a somewhat older person like me, who is a professor, could also build a successful startup. That was not really the image that people have of founders of companies. So it was quite a discussion also with the board of directors. How does that work? Conflict of interest, but in the end we got this done, also with the help of valorization, and I got permission to start to do this on the condition when it became successful. After a couple of years, I had to decide either you stay in the company or you go or you stay in the university, you go to the company with the majority of your of the work. So I decided that time for the company, because it was really nice to do this, to build this up. Initial funding, I did that with my co-founder. We went through the first year with our own money, hired a couple of people, build the first product, and at that time, especially the support from Radboud, but also from SMB, in particular John Schalken, I saw is also in the call here, was very helpful. We made use of a small subsidy also to get our quality management system in place and so on. So then the second phase, we moved to another location because it became too small. We expanded the company to about 20 people. We did our clinical studies, got regulatory clearance, FDA and CE, and all the time we used the relations with Radboud, but also with other mainly key opinion leaders in Europe to do a lot of scientific work, also to establish ourselves in the market also as a leading company in the field. And we were very happy in 2018 that Siemens Healthineers came on board as an investor in one of our investment rounds, which gave a lot more stability to the company and also, of course, a good market channel. And where we are now is we are back at the campus because we've grown out of the space at the station location. We are now with around 40 employees. We have a number of people working in the US. And we are still expanding the evidence because introduction of AI in healthcare, well, you need to have a long breath because things in healthcare don't change overnight, as all of you know. But we are starting to be pretty successful, building up our sales network and through distributors, but also a direct And where we are now is that we have products in about 23 countries, over 100 clinics, and we are starting to grow now quite quickly. And hopefully in a couple of weeks' time, you can see the news that we have a new investor on board to take us into the new phase of the company, where we expect to double in size in the next 1.5 years. So that was my presentation. I think there may be some questions. So over to you, Martijn. You're still muted. And Martijn, I'm not sure if you're talking, but you're muted.
Indeed. No, I just said that I once read some research that showed that the best age to start a startup is 42. I don't know if it's by accident. That's the same number from the Hitchhiker's Guide to the Galaxy, but the 42 seems to be the magic number there. So that's good. There was one question I see. Do you get sufficiently high quality images as input for your algorithms?
Yes, we are lucky in this field that mammography is not the most rare exam in the world. It's about 80 million every year screening exams. So basically, you can make a lot of connections, collaborations to get data. It's a lot of work, but we have a lot of data and we spend a lot of time on it also.
Yeah. And the resolution of those images is in general enough for this kind of algorithms.
Yes, we take the original resolution, and in radiology, mammography is the exam with the highest resolution. These are huge images.
Okay, yeah. Considering time, we'll get you. There's some questions, but we'll get these to you later on. Then I would like to move to Sven.
Yeah, maybe Martijn, before moving on. So as you know, I have an important meeting starting in 7 minutes, so I'll be here for some time. But then maybe at 5 o'clock I can join again. So.
Thank you very much. And if not, I can send you the question later on, and you can answer. Yeah. Yeah. Okay. Now I would like to go to Sven from IMEC iStart to start his presentation.
There we are.
The floor is yours.
Thank you, Martijn, and thank you for the opportunity to, well, basically highlight why IMEC iStart is interested to come to Gelderland. Maybe a few words first on I would say the mothership IMEC. So I'm part of the big IMEC organization, which is a research institute on digital technologies and nanotech. So to put it to oversimplify things, probably both the hard and the software side of digital technologies. And actually, IMEC is the largest independent research institute globally in this area. IMEC is actually based in Leuven, in Flanders, Belgium. And as you can see, the tower, the headquarters, it obviously reminds you of one of the buildings, the famous buildings in Nijmegen. So we're also, I would say, architecture-wise close to one another. On the side, IMEC also has been active in the Netherlands actually for over 15 years now. Back in 2006, IMEC teamed up with the TNO by forming the Hol Center on the high-tech campus in Eindhoven. And more recently, in 2019, obviously also joined forces with some very strong players in the Gelderland ecosystem, with Radboud UMC, and also the WUR, to form the One Planet Research Center and conduct research activities there and bring a lot of disciplines together in the health and agri-food domains. Now, as part of that big research institute, IMEC has created also an accelerator program to stimulate entrepreneurship and support high-tech and deep-tech startups and spin-offs. So we created the program back 10 years ago. And to be clear, IMEC iStart as accelerator is not only supporting spin-offs coming from IMEC research groups, but is basically open to any startup, irrespective of whether they have an IP or technology relationship with IMEC or not. So that relationship is not needed for us in order to be able to support ventures. And as Martijn rightfully said in his introduction earlier, we believe we have some, I would say, assets in supporting, especially that high tech and deep tech type of startups, especially because we have a more, I would say, extended support program. Our accelerator program takes 12 months for, I would say, as a standard program, and even 18 months as a standard program for health-related type of startups and spin-offs. Because of course, before you're able to go to the market with a health, e-health or medtech product, there is a lot of steps to be taken. I mean, needless to convince you of that fact. And in that sense, IMEC iStart actually, as an accelerator program, focuses on the transition of typically a first rough proof of concept of a first product, so slightly more than an idea, I would say. And by the end of the formal 18-month program duration, we want basically the company to have reached 4 milestones. The first one is what we call product readiness, where the product is validated with actual or future customers, and where it is also able to go through the market. And in healthcare, of course, that also entails certification. The second one is what we call market readiness, where we also help the startups and the spin-offs to prepare for market launch, and ideally also get first paying customers. And that includes validating their go-to-market strategy, their pricing strategy, and so forth. Everything that goes hand in hand with bringing that first product to the market. The third aspect, or the third key milestone, is what we call growth readiness, where we help at 2 levels, basically. First, we help the startup as organization, as company, to get ready for growth by installing the right processes. And then I'm talking both as the more internally oriented processes like finance, legal, HR, as well as the more externally oriented processes like sales, marketing, and so forth. And also it entails helping the entrepreneur to grow as an individual by enriching him or her with additional skills and expertise and know-how to be ready also to lead his or her venture through the next stage. And the last key milestone we help with is what we call investor readiness, where we obviously also want to help the startup and spin-offs to get ready to attract additional funding from whatever relevant source for their specific business case to also fuel their further growth. Now, so the program basically is a combination of coaching and mentoring on one hand, but also, and I'll get a bit more in detail on the next slide, also goes hand in hand with the pre-seed investment we make ourselves into the companies. And that pre-seed investment starts from 50K for each of the startups we accept in the accelerator program to max 250K in total per venture now. When startups graduate from the program and hopefully reached all those 4 key milestones, our support doesn't end there. So even though we believe through that extended accelerator program, especially when you compare it to some other programs internationally, we believe we can get the fundamentals of a company right and well in place. Even our alumni receive basically all the support that they had access to while in the program. So we further support them in further fundraising, in attracting the right talent, in potentially wherever feasible, strengthening them on the technology side, or help them internationalize, for example. So basically, companies in IMEC iStart receive lifelong support, and lifelong basically means as long as we're a shareholder in the company. Not going through in too much detail in our selection process, but we work call-based, so cohort-based. So we have currently in Belgium 3 open calls per year in which startups can apply. And the full evaluation cycle for each call takes max 3 weeks. So that means 3 weeks after applying to the program, every startup has received feedback and knows whether they will be supported in the program and also whether they will receive the investment, yes or no. And of course, the program and the investment go hand in hand in our case. Also, I would say on running a program, we have a slightly different view than most programs out there in the sense that we have a lot of domains in which we help the startups, but we don't have a fixed program that every startup follows. You should rather look at it as a menu list of potential services where startups can basically pick whatever service is most relevant for them at any specific point in time. So that means, for example, under the what you can see here as access to coaching umbrella, we have a menu list of about 25 different workshop topics where we can bring in workshop experts providing in-depth coaching and training on a very specific workshop, and also help to apply it on your specific case. But first of all, not all the startups take all the workshops and don't all take it at the same time in their development process. They take it whenever it's most relevant to them. And that's basically the same for all the building blocks of the program. So there is no fixed program for everyone. It's rather a long menu list of or catalog of potential services. And as I said, IMEC iStart also invests in the companies that we support. So this is basically the setup in Belgium currently. So we set up initially a 12.5 million euro investment fund back in 2017 that we 2 weeks ago transformed into an evergreen fund, and also increased the fund size to more than 30 million euros in fund size with the partners you see listed there. And what is important here is not, I would say, the size of the fund. I think it's more the evergreen character of the fund. That basically means we don't have a specific end date for our fund. And that also means we don't need to strive for an exit with your company before a very specific date. We can be a shareholder and supporting partner to the startups we invest in for an extended period of time. So there's no pressure towards an exit. Some key figures to give you an idea of, I would say, the experience we built up over the past 10 years. So we have helped and are still helping actively 235 startups and spin-offs in different areas. However, I would say of that, the 235, by far the largest group is healthcare type of startups. So I think we have 45 of them are in the broad e-health and medtech domain. Over 70 of our ventures have become real scale-ups already, and scale-ups is really at least $1 million plus in annual revenues and 20 plus people they employ. You also can notice the, I would say, quite significant survival rate of our startups. So 81% is an extremely high survival rate in technology-based ventures. I attribute that success rate to a number of factors. One is, I hope, quite a good selection process. Secondly, to some extent, luck as well, of course. And in third instance, hopefully also to some extent to the coaching we provide and the support we provide. Not going to run through all the key figures here, but the last one I'll pick out is the 376 million in follow-up financing on the top right-hand side of the slide. That the total amount of follow-up financing attracted by our portfolio ventures. And what is important there is not the number as such, in my opinion, but it's the leverage effect we create. That number basically means for every euro we invested in cash into the startups we support, they on average now attracted over 26 times that amount in follow-up financing. And that leverage ratio is still growing quite heavily. And on the bottom of the slide, you can also see, and we're obviously quite proud of that, for a couple of years in a row now, we have been benchmarked by UBI Global, that's an independent Swedish organization, as the #1 university-linked business accelerator in Europe and the #4 globally. And of course, that is thanks to the hard work of our entrepreneurs day in, day out in first instance, but we gladly take some credits for that as well. Now, what is also important for us is that we work in a combination, in a public-private partnership. So we like to work in that environment, of course, being a research institute ourselves. We think we know pretty well what it is to conduct research and develop new technologies there. But we also fully recognize that we help to transition, especially the spin-offs, from a more research-driven environment to a more commercial environment. And as an accelerator program, we still work pretty early stage. So it's not a stage where the private sector is typically fully willing to pick up what is needed there to create such programs and finance them. But on the other hand, we also want to make the bridge between more publicly funded type of things and the more private sector. So we work with a lot of public and private partners, where the private partners can also help accelerate the go-to-market strategy of the ventures we support. And you see here a list of some of our partners, including, for example, in healthcare, large multinational players like Pfizer and UCB and Roche, that also help our ventures through some mentoring sessions by sharing expertise and potentially also acting as first customer or a go-to-market partner. And if at some point, if there are, and I'm sure there are entrepreneurs here in the audience, at some point in time you would want to join our program, you'll definitely be in good company. Those are, I would say, some of our scale-ups, in which I'll pick a few that really are growing very fast currently, like the one in the center and middle is LindaCare, a remote monitoring platform for heart patients. They received, by the way, an investment from Philips Healthcare, which also helps them now in their international go-to-market strategy. So that's one example of our scale-ups. We have a few that employ now over 200 people. So some of them are growing really fast. Now then you can question why bringing IMEC iStart to the Netherlands. Well, basically, we started off the exploration with the creation of the One Planet Research Center, where our local IMEC management team said, like, okay, we agreed on some KPIs with the Gelderland region on spin-off creation and SME interaction. Could IMEC iStart play a role in that, in achieving those targets? Our reaction was, well, we don't know. We should first explore what the Dutch landscape is looking like, because of course there are much more relevant initiatives now in the Netherlands than there were in Belgium back 10 years ago when we started. So first we explored the landscape to see if we could bring something additional to the Dutch landscape that wasn't there yet. And we were, I would say, positively surprised by the very enthusiastic reactions we received. So basically, driven on our presence through the whole center and One Planet Research Center activities, we want to come to the Netherlands. We see that there is potentially a good place for us, but we also want to do it the right way. And what do I mean with the right way? Really building up a local presence with a local Dutch team. The local presence will primarily be built initially in Wageningen and Nijmegen, so the two hubs of One Planet, and Enschede, where we will also have a strong partnership with Novelty at the TU Twente. So that will be in both regions, that will be where I would say the core and the heart of our operations will be. So it's not a Belgian team that comes to run a program in the Netherlands. It's really a dedicated Dutch team embedded locally in the Dutch ecosystem, in the Gelderland ecosystem, that will run the program. And even though we will be open to, I would say, all high-tech and deep-tech startups in many different domains, the heart and the initial focus will definitely be on 4 core domains, being the healthcare domain, and of course, that's the most relevant to you guys, but also the agri-food domain, Industry 4.0, and the energy domains. And we are working very hard to be able to launch our first cohort in September of this year. And currently, I would say everything is looking good that we will be able to do so. And of course, I would say that this is my last slide. It's an open invitation. If you see opportunities to collaborate with us in those ambitions, either if you are an entrepreneur, a potential startup or spin-off that is potentially interested to learn more about the program or might want to join, feel free to reach out. And of course, we're also building up our mentor network, some program partners, our investor network, and so forth. So if there is any interest in joining our initiative, I would say in any form, don't hesitate to reach out, and we'd be more than happy to follow up on that one. This being said, I'm closing off my presentation and giving the floor back to Martijn.
Thank you, Sven, very much. Yes, I would like to stress again the last point that Sven made. We are really looking for partners in all kinds of roles around this program. So if anyone is interested, either contact Sven or me, and we'll see where we can take it from there. We are a bit short of time. There were 2 questions. One I think is a bit long, so I'll send it by email to you, by Teun Buurman. But the other one, Peter Dana, I think is shorter. Sven, what part of the shares is asked for startups who want to join the program?
Yeah. I'll try to answer very shortly indeed. So typically the basic investment we make in all the startups is at least 50K, plus of course all the in-kind support in the program lifelong. That typically we ask for a 6% equity stake in the company for that. And any additional investment is typically aligned with any other investor coming in. So that's that can be at any valuation or at any conditions typically.
Thank you. Okay, thank you very much. A big round of applause, of course, for Sven. Thank you all.
Can everybody hear me? And is my presentation on screen?
I can hear you and I can see your presentation.
Okay, so my presentation is about entrepreneurship and the Radboud University Medical Center, where I hold the double position of the TTO director as well as of the holding company. And I will explain a little bit further down the line why that is a double function. So very briefly about our mission. Mark at the opening told you about the mission of the UMC as a whole, and we translated that for our department into guiding innovation towards significant impact. And specifically for the holding is for a large part an instrument to fulfill our valorization strategy. So of course it's one of two major paths towards a real innovation. Once something comes, once we have something within the university, we can either work with existing companies or we can work with investors and entrepreneurs and start a new company. So that's why in that case the holding comes in. So we have defined a couple of strategic goals for the holding company. Two are more direct. So spin-offs, well, we've just seen two very nice examples of spin-offs from the Radboud UMC. I think everybody can imagine what we mean with a spin-off, but we also have something we call in Dutch strategische deelnemingen. I would say a strategic enterprise, usually wholly owned subsidiaries, not always, sometimes together with other UMCs. We have a handful of those. They also play a role in our innovation strategy in the sense that some of these companies, we offer knowledge services or facilities that can help other companies to innovate or accelerate their innovation. So one example of that, of such a company, is the Radboud Translational Medicine BV, which can produce isotopes for diagnostics, and that is of course a great tool in drug discovery and development. So those are the two direct effects. We try to reach our goals with the companies themselves that we have in our portfolio. But together, and Corné already mentioned nicely, synergies together with those companies, 1 and 1 is 3, because these companies are then part of a innovative ecosystem, and in that sense, we build our network. And as everybody knows, it's becoming more and more important that everybody realizes you cannot do everything by yourself. So we need each other. We need companies, direct companies, we need CROs, and we need the knowledge institutes in order to really get to groundbreaking innovations. And finally, an important goal also is with the holding and the valorization together is one important pillar in our innovation strategy. And in that sense, we try to contribute to the innovative culture that we think is needed, and more opening up, coming out of the academic ivory towers, and collaborate with the outside world. Yeah, and I think that this is something that a lot of people will recognize. How does it then all work together? This is just one model to look at an innovation ecosystem, but you need a lot of different parts, moving parts that are interconnected. This is from Otto Raspe, the Raspe model. And entrepreneurship, of course, is one very important element in there. But by itself, it doesn't mean anything. Just as knowledge infrastructure doesn't mean anything by itself. But if we then zoom in on ondernemerschap or entrepreneurship, what is it really? We talk a lot about it, but how could you define it? And when I thought about this presentation, I think you can distinguish between ondernemendheid, being entrepreneurial, and really being an entrepreneur. So having a company and trying to the French word, of course, is being the middleman. You're trying to make some money. Now that, of course, never is the goal in itself in an innovative company. But if you look at the qualities that you need as an entrepreneur, you have to be result-oriented, you have to be ambitious, you have to be focused, creative, and resourceful. But if you take a step back and you look at these qualities, you look at these competencies, I think you might just as well say that a researcher also needs these competencies. So I think there should be already a natural link between research and entrepreneurs. And I think that's we have some nice examples. I recall one of the very early SMB presentations from Jacques Schalken from Noviogendics. One of the first pioneering spin-offs from the Radboudumc, even before the time our department was founded back in 2008. He had a slide where he showed his publications and the development of Noviogendics as a spin-off where he was involved, and he was someone that could was very driven at finding the synergy between his company and his role as a researcher. And there's also a nice publication by the Radboudumc Institute that does a lot of research into academic research and publishes about it, about the different profiles that you see. And I think so. I think the culture is shifting, but you see about 1/3 of researchers are very naturally open and interested in this. In the world of business and see where the synergies are. And maybe 1/3 is interested but doesn't really know how, so they need to be maybe a little bit helped and aangemoedigd to start doing something in this space. And maybe the more conservative part would say, well, you know, I'd like to do really curiosity-driven research, academic research. I mean, it's not my role to be in the business community. I think it's good that at least everybody realizes what your own personal ambition is. I think also this is, of course, shaped by, I believe, we call it an ecosystem. So on the one hand, you're born with certain talents, and on the other hand, those talents are shaped by your environment. So there are, of course, also some differences between the business world and the academic world. And I think we all have some images there what those differences are. I think two very important ones are the stereotype of a researcher is there's always something better, there's always something new. Maybe we already are 99% effective in something, but the typical academic researcher doesn't like uncertainty. He wants to know for sure. And I think from the other hand, the prejudice about businesses is that, well, every 2 years there's a new CEO, there's a new strategy. PhD programs last for 4 years. So a really long-term collaboration with a business is something that a researcher can be wary of, because you never know if the funding is pulled 3 months later. I think, I mean, there are prejudices. Sometimes these instances, sometimes they're correct, but more often they're not. And I think awareness about each other's culture is something that will already help to bridge that. And that's what we like to think, that from the TTO department, we try to bring those two cultures together, knowing that in fact, we're a lot alike. Well, then you could ask the question, so if you think entrepreneurship is so important for your university medical center, what do you do then? So the hashtag how then, yeah? The hashtag hoe dan? Well, I'll give three brief examples. The first one is around creating awareness. So this is an example from within the Radboud University Medical Center, where the new students, so really in their bachelor phase, that are coming here to study medicine, already in their very first year, in their first quarter, they are assigned, they have to find other students, form a little group and start an innovation project. So and then you can ask, well, the students themselves ask, well, we just started here. We just want to get some biology and chemistry classes, you know. How can we come up with an innovation? I think the great thing is now that now that this new curriculum exists a few years, there are actually really good ideas coming out of these groups, looking at, for example, going around into our hospital, asking physicians, what kind of problems do you encounter in your daily workflow? Also asking nurses and patients, because they maybe have even more ideas for short-term incremental innovations that really can have an impact. And in the meantime, so there are some projects that actually students took with them into the further down the line in their career, and we actually had some conversations about should they patent something or not, because of course in the student phase it's from the student. So it's I think this is one way. There are of course many other examples. Someone in the call early on from the audience already mentioned, I think he was referring to the ITN programs from the EU. We have the Paul Janssen Future Lab in Leiden that's putting out workshops. Of course, regionally we do a lot with Health Valley and Briskr. But this is important to already start with the newer generations awareness around innovation. Now, if you don't have someone that's interested, okay, then what? So then there are other programs that we can start. This is an example, the Faculty of Impact. This is an article from the Dutch Financial Times, Financial Dagblad, from late last year. This is an initiative collaboratively by the NFU and the VSNU, so the sort of the two organizations from all Dutch universities and university medical centers. It's a program where we're trying to get funding and launch this, where someone who is at the end of their PhD or maybe just an early postdoc has some interesting deep tech ideas, but it's not ready enough to really go, for example, into an accelerated program that IMEC iStart is running. It still needs it needs grooming, and what do you need to groom? You need interaction. You need to be challenged by others. What the program then does is it gives a researcher, young researcher, 2 years of funding, so you can stay within the Knowledge Institute. And we try to build a program collaboratively with all the TTOs and all the partners, and use our network, for example, to put someone in a position at the company for 3 months, to really challenge them and further their idea. Now, there are of course more programs like this, either in local institutions and nationally, internationally. I think this again is an example of how do we get entrepreneurial spirit into competencies. How do we develop them with Now, the final example is Spark Global. Actually, it started with Spark Stanford. It's not something that we can announce. I would really like to see that. We've been discussing it internally already for quite some time. It's a little bit difficult to find the right scope. But I think with all the attention that there is right now for innovative ecosystems and clusters, for example, through Groeifonds, that the time is ripe to start something like this. The nice thing about this program is that it really encourages interaction between researchers and companies. And how does it do that? What they did at Stanford is there's a pizza session every 2 weeks, like our small SMB meeting every month. And what do? There is some funding in the program where early ideas within the institution can pitch and can get some funding to get a project more investor ready, ready for the companies that are in the local ecosystem, or for the investors, or where entrepreneurs can pick up. And what you then do is every 2 weeks you have you have different teams that are in the program presenting their progress. So you also get you start building a relationship with, and it's not just a single pitch. It's a recurring project that's coming back, and where people from industry are invited to come along and just shoot from the hip and give feedback. And in Stanford, this worked really well. That they focused it on a specific theme around drug discovery and development. But that's one of the discussions that we're having is how should we scope it, and do we have enough critical mass here in the region? Region meaning a little bit broader spectrum, or should it be something nationally? This is to be decided. But these are all initiatives where we really want to encourage public-private partnerships, even without the subsidy organizations telling us that we have to collaborate, but we really start collaborating from an intrinsic motivation of getting research into innovation. Okay, finally, a little bit, what do we do then from the valorization and the TTO department in a little bit more detail? So we actively support spin-offs. We have our policies around that. So researchers can have a stake in the company. There is this national guideline of no more than 5% for a researcher. I always say 5% of what, because 5% of Pfizer is a little bit different than 5% of a one-man show. So in that sense, that's why we left that. We also support the companies sort of in the phase right around maybe a year before until a year after incorporation. That's the phase where we're most heavily involved. We can support the company financially. You saw from Corné that if you looked at the slide in detail, that we also provided a small loan, just enough that you can get things started when you incorporate, and you don't have to start running for money right from the start. We have a team of business development in the TTO, 5 people that are very active in leading up to the incorporation, helping with the business plan and giving advice. We have a pretty broad network. Also with some of the werving and selectie agencies. So if we think there is a good researcher, but he's not yet ready to be a CEO, not like Nico was, then we can try to find someone and complement the team really. And once we incorporate, we also stay with the company for coaching and advice, and it can be from very operational on the legal side to, of course, from the shareholder perspective, you stay with the company in the early phases. As soon as other investors step in, then we let them take over that role. And finally, we support with facilities. At least we broker if facilities from the science departments are needed. We try to broker there. And we are actually also, for example, working on a plan for a life science incubator here on campus. So we hope to realize that within the next few years, and that's then also something that we can offer to a startup. And with this active policy, if you look currently, we for this at the end of this year, we aim to have between 15 and 20 spin-offs. Now, of course, it's an ecosystem. It also means there is selection. So not everybody will survive, and I don't expect we will hit the 80% ultimately like IMEC iStart will. But ultimately, we believe we will reach a steady state around 30, 40 companies within the, hopefully within the vicinity of our Knowledge Institute, and that we can collaborate with and get our innovations to the market. Now, we don't do all of this alone. Actually, the holding itself is just mostly me and Dennis, who is in the call. So it's a pretty small show, of course, with a lot of support from our colleagues within the TTO, business development, and Sean van Sambeek through SMB. But of course, then we broaden out. We work together with investors, Tuya Oostenel, among others. Makate Launch has a nice program for student entrepreneurship. Health Valley, all the partners behind the economic board, so the province and the gemeente Nijmegen, and the strategic collaborations that we have with the companies around us. So I think that nicely shows that we try to play our role in developing this ecosystem. Thank you, Martijn, for having the opportunity to tell a little bit more about this.
Thank you. Big round of applause, of course. Everybody invited. Yes, thank you. There are a couple of questions, but considering time, I'll ask one. Peter Dane asks, to what extent are the PhD postdoc programs of the RUMC in competition with the IMEC program?
I think they are complementary.
Sorry?
I would say that they are complementary, and when it's complementary, of course, in a single instance, there can be overlap. But the IMEC iStart, Sven, correct me if I'm wrong, you have to be a company. So I think we try to get something towards company ready. And when it is, then IMEC, if you're within the scope of the program, I think it's a very good opportunity to get you through the early phase once you've incorporated.
Yeah, fully agree with that complementarity. Just one sentence to add in it. When applying to the program, there is no need to be a company yet, but once we start to support, we want the company to be created. And indeed, I see it more as like I would say a train with different wagons, where potentially you could first take the PhD or postdoc program, and then transition to the IMEC iStart program potentially. So I see it as a nice continuum. And of course, in the continuum, there is some overlap, but I think it's limited.
Okay, clear. Yes, considering time, I think we'll wrap it up. I thank you all for your attention. Thank all the speakers for their contribution, and please one last round of applause for everybody and for all the questions. In the chat, Marion will copy a link, I think, for the evaluation form. We kindly ask you to fill in the evaluation form so we can get some feedback and improve these kind of meetings. Does that work, Marion? Do you have the... Can't hear you. Well, let's see, and otherwise everybody gets it through the email. Okay, can you do the link in the chat? So people can just click on it, and very good. For all those who stay for networking, please stay online, and you will be placed in a breakout room with some random strangers. See you all next time. The 1st of July, we have our next SMB meeting, and that will be focused on MedTech. And we will do that together with University of Twente, the TechMed Center from Renkenbury. I thank you all, and I hope to see you next time. Bye-bye.